Okay, so every 5 years, this huge report comes out that quietly dictates how millions of us eat. While the brand new 2025 Dietary Guidelines just dropped, and honestly, it's a total game changer. It's like a whole new blueprint for the nation's health. So let's dive in and see what's changed and why it's such a big deal.
And right off the bat, you can tell this year is different. I mean, we're not just talking about the same old food groups. For the very first time, the committee kicked things off with a question that really changes the whole conversation. They asked, what if our national diet plan wasn't this rigid, one-size-fits-all thing? What if it was actually designed for everyone, to reflect all the different cultures and traditions we have in the US?
So you might be asking, why the big shakeup? Why now? Well, to get that, we've got to take a hard look at some of the really serious health challenges facing the country. And let me tell you, the numbers, they're pretty staggering.
Let's just start with this one. 73%. That's nearly 3 out of every 4 adults in the US dealing with overweight or obesity. That's not just a number on a chart. It's a full-blown public health crisis, and it's affecting families and communities everywhere.
And listen, this isn't just an adult problem. It's starting earlier and earlier. More than a third of American kids and teens are facing the very same issues. And that's really scary because it's not just about their health right now. It's about setting them up for a whole lifetime of potential health risks.
And if you want to see just how real that long-term risk is, look at this. A whopping 38% of teenagers, we're talking ages 12 to 19, now have prediabetes. That is a huge red flag. It's basically a warning sign that the clock is ticking on preventing a massive wave of chronic disease down the road.
But here's the thing. These numbers, as big as they are, don't even tell the full story. Because this crisis, it doesn't hit everyone the same way. When you dig into the data, you see these huge disparities. For instance, the rate of obesity for non-Hispanic Black adults is way higher than the national average. At the same time, it's lower for non-Hispanic Asian adults. And what that tells us is, yeah, we have a health problem, but we also have a major health equity problem.
And that right there brings us to the core of the committee's new mission. This is a big deal. For the first time ever, they've put health equity front and center. I mean, it's the absolute focus of their work, with the goal of tackling these disparities head on. Okay, so what does health equity actually mean? It sounds kind of academic, right? But the committee's definition is pretty straightforward. It's the state where every single person has a fair and just chance to be as healthy as they can be. It's all about knocking down the barriers that get in the way.
And I want to be clear, this wasn't just them throwing a buzzword around. No way. They literally built their entire process around this idea. They broke down all the data by race, income, ethnicity. They went looking specifically for studies tailored to different cultures. And, this is really cool, they even ran diet simulations to see how their advice would work with all sorts of different food traditions. This was a really serious, methodical effort to make this idea a reality.
All right, so now that they're looking at everything through this new lens of equity, what did the science actually tell them? The committee pointed out a few key takeaways that we should all probably be paying attention to. First up, saturated fat. The thinking here has really changed. The big takeaway isn't just to cut back on stuff like butter or red meat. The real win for your heart comes from what you replace it with. Swapping those things out for plant-based foods that have healthier fats, think vegetable oils, nuts, beans, that's where the magic really happens. When it comes to what we're drinking, the advice is actually super simple. Make plain old water your go-to. Try to limit sugary drinks. The science is pretty solid that they're linked to not so great health outcomes. And yeah, there's still more research to do on things like 100% juice and low-cal sweeteners, but the main message is crystal clear.
They also hammered home a really simple but incredibly powerful principle. Bigger portions make us eat more, especially when it comes to foods that are packed with calories. I know, it sounds like a no-duh moment, right? But it's actually a huge driver behind those health stats we looked at earlier.
Okay, so you take all this science, you filter it through this new focus on equity, and what do you get? Well, the committee came up with what they're calling a landmark solution. It's a completely new way to think about what a healthy diet looks like. And their big answer is a new framework they call the Eat Healthy Your Way dietary pattern. And honestly, the name really says it all, doesn't it? The whole idea isn't about a strict set of rules anymore. It's all about flexibility, making it personal, and including everyone. And this slide just perfectly illustrates that shift in thinking. Just look at how they've reorganized the protein group. For the very first time, plant-based proteins, beans, peas, lentils, are at the top of the list. They're being prioritized. Now, meat, poultry, and eggs are definitely still on the list, but you can see the emphasis has totally changed.
So, let's get practical. What does this whole new your way approach actually mean for you and me?
Okay, here are the main ideas. It's designed to be flexible, so it actually fits into your life. It's inclusive, so it respects your cultural foods. And it's practical, so it works with your budget. It really puts a spotlight on those plant-based proteins we just talked about. And, this is a big one, it gets rid of some of those confusing old categories, so the advice is just a lot clearer and easier to follow.
And you don't have to take my word for it. Here it is, straight from the committee. They say the key tenets are flexibility and inclusivity, recognizing that everyone in the U.S., with all their different backgrounds and food ways, can eat a healthy diet. I mean, that's a pretty powerful statement, right?
And all of this leaves us with one last really big question. We know the old way, that one-size-fits-all approach, it just hasn't worked to solve our health crisis. So could this new way of thinking, this guide that's built on flexibility, inclusivity, and personal choice, could this finally be the key to a healthier nation for everybody?